Tuberculosis, or TB, is a bacterial infection caused by Mycobacterium tuberculosis. It involves the lungs and can spread to other organs such as the kidney, spine, and the brain. TB may be spread through the air from person to person through coughing, sneezing, speaking, or laughing. There are two forms of TB. Latent TB is inactive, non-infectious, and does not exhibit symptoms. Active TB is infectious and evident through its symptoms. If not properly treated, active tuberculosis can be very severe and can even lead to death. Symptoms may include fever, chills, loss of appetite, unexplained weight loss, tiredness, chest pains, coughing up blood. Experiencing any of these symptoms should prompt you to seek medical attention. There are several methods that a healthcare professional can use to identify tuberculosis. First, a complete physical examination is performed to evaluate the patient's overall condition. A physical examination can provide valuable information about the patient's overall condition and other factors that may affect how TB is treated, such as an HIV infection or other illnesses. Next, a Man2 TB skin test is used to detect the presence of M. tuberculosis. This test is done by injecting a fluid called tuberculin under the skin on the patient's forearm. The patient must return within 2 to 3 days to have it read. A trained healthcare professional will check his arm for swelling at the site of injection. Depending on the level of swelling, a positive or negative result is determined. In this case, this is a positive result. A positive skin test is followed by a chest x-ray to look for irregularities that may suggest a tuberculosis infection. Abnormal spots in the lungs may vary in size and shape. In this case, the spots are present in the lungs. It is likely to be tuberculosis. The final diagnosis is made after lab testing. First, an acid-fast bacilli test is done on the mucus that is coughed up. A red dye will reveal rod-shaped organisms. Then, to confirm the diagnosis of TB, a culture is done. The organisms from the mucus are grown in a dish inside of a lab and then confirmed to be M. tuberculosis. Drug treatments for tuberculosis can last up to 6 months in order to completely get rid of the bacterial infection. The most common drugs to treat TB include isoniazid, rifampin, ethambutol, pyrazinamide, or a combination of these drugs. Isoniazid, also known as Tubazid, can be taken by mouth as a syrup, tablet, or injected in the muscle or vein with a dosage of 300 milligrams. This drug prevents the bacteria from making a protective barrier, thus killing the bacteria. Rifampin, also known as Rifadin, is taken by mouth as a capsule in dosages of 150 milligrams and 300 milligrams. Rifampin stops the bacterial infection from growing and dividing. Ethambutol or myambutol is taken by mouth as a tablet in dosages of 100 milligrams and 400 milligrams. This drug stops the bacteria's barrier from being formed. Pyrazinamide is also taken by mouth as a tablet in a dosage of 500 milligrams. This drug prevents the bacteria from using energy to function and survive. Your pharmacist and other healthcare professionals serve as a great resource to understand how to take these medications. Taking them as directed is a sure way to completely treat tuberculosis.